Because of the mysterious and elusive nature of this condition called fibromyalgia, obviously there's no standard of care. Obviously it's very difficult to diagnose and even more challenging to treat. So one of the questions that I inevitably get asked is, are there any other therapies available that I could try? Well, let's talk about that for a moment, because injection therapy is another excellent alternative to some of the more conventional treatments. But there is many ways to perform this as there are needle therapists. One technique is a modified version of what they call intramuscular stimulation, or IMS. Now this involves breaking loose virtually all the scars in the muscles of the neck, mid-back, and low back. The problem with this technique is that it involves literally 200 to 300 needle injections, most of which are quite painful. Now another therapy that's become very prominent of late is magnetic therapy for pain and prevention. There are several types of magnet therapy. There is large electronic magnetic therapy, which fits around your body like a donut. There are several smaller versions of the electronic magnetic therapy, which are almost like magnetic heating blankets. There are even small mineral magnets which stick to your body, and large mineral magnets which strap to your body. Now I find them all to be helpful in some way, but in fact magnets are unlikely to be the sole source of recovery for fibromyalgia. Massage therapy is a classic therapy that can be very effective as an adjunct to fibromyalgia treatment. Patients who suffer mild symptoms may benefit even more from massage therapy, but I would still add some stretching and some movement therapy. Now heat is very important as a therapy in itself. Many physicians are advocates for cold, whereas I'm a strong advocate for heat. But as with all things fibromyalgia, it's trial and error, and it's going to be necessary for most of you to find which works best for you. And it may vary time to time, area to area, and person to person. Exercise is important to keep up in some way. And I know this can be very difficult or near impossible for severe fibromyalgics. I often suggest something simple like walking, swimming, or even biking in limited amounts. But remember to stretch before, sometimes during, and of course always after the exercise. You will be stretching after exercise, and you'll find that as you do this, it's going to become easier and more effective in terms of reducing and minimizing the accumulation of symptoms. Drugs. Now, doctors have an excellent knowledge of the pros and cons of medication and supplemental and herbal therapy. But I should add that supplements and herbs are not the same thing. Supplements are substances that supplement what you already have in your body. Herbs, on the other hand, are sometimes supplementing what you already have, but are more often new chemicals that are foreign to your body, like prescription medications. All of them can be very, all of them can be very helpful, but should be considered to be medications with potential side effects. Now, the mainstay of any conventional doctor for treatment of the fibromyalgia symptoms includes non-steroidal anti-inflammatories. These medications can be very helpful in the short term, and they will work to allow the spinal muscles to return to their normal length following a protocol of home therapy and exercise and heat. But they are not a cure-all, and they are not a long-term solution. Supplements can also be very helpful, but there's so many of them, and the science behind them is so huge, I'm going to list just a few here, like the old standbys of glucosamine sulfate, chondroitin, devil and cat's claw and shark's cartilage. But most of these products are aimed at cartilage supplementation and reducing inflammation, which usually isn't a primary issue in fibromyalgia. Now, I found all of them to be helpful in some way, but greatly successful for a reserved few. Now, another recent player is MSM. It's not, unfortunately, been shown to be the cure-all that was promised. I also recommend a highly concentrated professional-grade omega-3 that has made a huge difference in some of my patients with this condition. It's also helpful for inflammation, mobility, and the brain and heart function. Now, other supplements include melatonin, a central brain hormone that can dramatically help sleep and pain in some. It also stimulates growth hormone secretion, but it is not completely proven to be safe. L-arginine is one of the many amino acids that stimulates growth hormone naturally and may become a major player for pain and rehabilitation. Creatine and pyruvate are muscle supplements that enhance aerobic or oxygen metabolism. Now, this has the effect of allowing the muscles to tolerate more injury with less shortening, i.e. less myofascial pain. Now, finally, there are the antioxidants, which may be of some benefit, as they can help to reduce the damaging free radicals that are moving through our bodies at all times. Everyday examples include vitamin A, vitamin C, and E, but some stronger ones include grapeseed extract and French maritime pine bark. Of course, it is not a great idea to combine all of these supplements at the same time, but rather to introduce them systematically so you can tell what's working, what's not working, and prevent any possible interactions. All this being said, as a doctor, I'm often frustrated when a patient tells me that their doctor told them their painful symptoms are chronic and that they will have to learn to live with them. Here's what most people don't understand. If you're suffering with pain caused by a chronic disease, you may not actually even be sick. You may just be unwell. Many commonly diagnosed chronic diseases may not be diseases at all, and this includes fibromyalgia. This may be nothing more than an undiagnosed imbalance or deficiency in your body. So the right test done by the right doctor at the right time can quickly, easily, and inexpensively find this imbalance, deficiency, treat it, and your pain will be gone for good. You know, over the years I've treated hundreds of fibromyalgia patients, and they've all asked me very similar questions about living with fibromyalgia. So if you've found this information valuable and you'd like to get the rest of the 20 frequently asked questions, then go to www.answerstofibromyalgia.com. In addition to these videos, I'm going to send you my fibromyalgia roadmap, a visual guide to controlling the symptoms and minimizing the discomfort of this disease, including what you should be doing over the next 90 days. This is Dr. Richard DiCenso, and here's to your health.